Today I'm going to talk about, I guess maybe the process or why I chose the doctor I chose, who's going to do the surgery. I did have a consultation years ago, probably 2009, I think, or 2010. And the doctor at that time, he really didn't leave me um, comfortable to proceed with him. When I asked him about what was causing the swelling, he didn't. When I was young, I was in several accidents that led to basically trauma to my left eye. Um, I slid into a coffee table at the age of 4, into the corner of a coffee table. That actually led to me getting a really bad black eye. Did not get treatment for that. Also, I'd been elbowed and all kinds of things as a competitive cheerleader. I was a flyer, and so I caught many elbows to the eye, and also just fighting as a child. So I ended up having kind of like this permanent black eye look on my left eye that looked puffy and swollen. And so that's what I wanted to get fixed primarily. Um, and that's why I went to have my consultate or what I had my consultations about. And so that just wanted to give you context because I did not talk about why my left eye was puffy in any of the other videos. Really have a good idea or a plan. He just said it could be swelling. And I can't remember what the medical term is. I think it's edema. But he didn't know. And he said he just had to open me up to see. He didn't offer any solutions, like maybe having a scan or something to, you know, to rule out certain things or to confirm things. Also, when I asked him, for the surgery, like how long will the results last, he didn't have an answer. He just said, I don't know, it could come back. Um, he just didn't, I didn't come out feeling comfortable. So I gave up for a while. Life happened, things happened. And when I started looking again, I came across Dr. Pradeep Mettu. Um, And so, before that, I started doing more research on what I should be looking for to find a doctor. And what I found is that in having this type of surgery, it is important to have a surgeon who has training specifically in the eye area because the eyes are important. We need our eyes to see. It's the first thing people see. And there's very delicate structures, around the eye. So it's very important that you have the right person working on it. It's not a very forgiving area. And I found that the recommendations is that you find a surgeon who is a ocular facial. Let me see, ocular facial surgeon, I believe. I hope I'm saying it right. If not, I'll correct it later, maybe. And also someone who's just had training in the eye area. So maybe somebody who's had, fellowships or experienced training in ophthalmology. So when I started searching in that way, that's when I found Dr. Pradeep Mettu, looked at his website. He had pictures, decent number of pictures of before and after surgery. Everything looked pretty good. Another thing that I want to mention that is very important, and I'd say for any doctor who you end up going to see for care, make sure you look up your doctor to see if that doctor's license is active. Also, to check to see if there's been any adverse uh, actions taken against that doctor to see if they've been sued or if they have had their license suspended at some time. So I just recommend, at least in the United States, looking up your doctor in the state in which they practice and doing a search. I looked up, so I'm in North Carolina, and I Googled NC physician license search or lookup. And so that's one of the things that you want to do before you proceed with going to that doctor. And trust me, I've actually found that I was seeing a doctor a long time ago who had ended up having many lawsuits filed against him. And I had already had some questionable care from him. So just again, that's a very important thing that you do. Make sure after you've looked up the credentials, you look up to see that that doctor's credentials are active and that he is a good doctor.
And then he had a very detailed uh, his website's very detailed, very detailed information about, pre-op, post-op, the process and so forth. So I made an appointment to have consultation. What I liked about the consultation is that he, I talked, I explained, what happened. He was very understanding. I felt like he listened. And then he suggested that I have a CT scan, an orbital CT scan, to make sure that there's no damage to the structures. And so I definitely like that, appreciate that, because the other doctor didn't mention that. And I had a CT scan. Everything's clear based on the CT scan. So then we had another appointment. And in this appointment, he talked a lot. He took a lot of pictures. I mean, a lot of pictures. My glasses off, looking up, down, around. Um, and then he also, did a physical examination, you know, touching, having me look up, and all that. And so after he did his examination, he said that he was almost certain that this was just fat that just been shifted and possibly just had more of it because of as a result of the trauma. Um, but he is confident that he can remove the fat. So, he talked about the process, and he was very, candid. I feel like he was candid in the results, in terms of saying, he's certain or almost certain that he can fix it. But in the case that, something happens and he can't, we can visit other options. And so I think that's good too in picking a doctor. When you pick a doctor and they're not overly confident, you want somebody to be honest, but you don't want somebody overselling, right? But he showed me the pictures, and he marked um, using some imaging software, just showing the fat and stuff. And he recommended I do this side too, because I have puffiness, and that's from aging and lack of sleep. So what I like also about Dr. Pradeep Mettu is that his training. I looked. He has, he's a doctor, of course. He's also has training in ocular facial surgery, ophthalmology, meaning that he's done additional training specifically in the eye. And another thing that I like about him is that the only thing he really does is deal with the eye. And I think that's important. The other person that I saw, had seen, I found later that he actually did more surgeries on nose. He did rhinoplasties, and then I think even some facelifts. To me, you want to find somebody who is an expert in one area when it comes to this types of surgery, right? So if he sees eyes all the time, to me that's comforting. Um, and so he said that's all he does. He deals with the eye. That's all. He doesn't do anything else. Um, Also, I think his technique. He mentioned that he uses the inner. He makes his incision inside the eyelid, which I think is important because I've heard that is, and he actually said it too, and I heard it. I learned this in my research. It's more complicated, but you have less side effects from making an incision inside. And for being a black woman, one issue that I would have is the possibility for scarring, hyperpigmentation. And if you make the scar on the outside, I've read that black people don't fare well with recovery using that technique. And we're more likely to have retraction of the eyelid because of the scar tissue that will form. And that's another thing I liked about Dr. Pradeep Mettu. He is Indian, I think. Um, and since he is a person of color, that means that, first off, he's going to be thinking about these things, right? Because he is a person of color. And so, also, a lot of his clients or patients, I've seen pictures. He's had a decent number of pictures of black people or people of color as well. And so, I like that. I like that he's, definitely worked on people. And so he knows some of the concerns. Hold on. Okay, so I think those things I like, I definitely, he's, been open. If I have questions, I email them. He always responds. I like that. It doesn't feel like he's too busy or, too good to respond to questions. As I mentioned, very thorough. And, I think I'm ready to do this. And the one other thing, because I was, you have all doctors and everybody's, they're going to have their testimonials are, they're going to put the positive stuff up, right? So on the website, he's got before and after. All those results are good. But and he said all his reviews are good too. Haven't found any negative ones. But sometimes, we know that negative, nobody's going to put up negative stuff on their website. So I went and did some digging and went to his Instagram page for his business and came across one of the black women who had eyelid surgery. And so she had commented on the post and said that, she thanked them and said, that the pictures didn't do justice on the results, showing the results. And so I went to her page and looked, and sure enough, I see what she's saying. The pictures, the before and after looked okay, but it wasn't spectacular. But when I looked at her other pictures she had on her page, then I was like, wow, it's a major difference. It could be because of time. I think he typically takes his after picture at the 3-month mark. And from what he told me, usually at that point, healing has been up to about 80%. You're 80% healed. So those pictures could have been later. And maybe that's why I just, like she's showing things when she was 100% healed. But man, I mean, those results are beautiful. Like, it's excellent. So those are the reasons why I I'm picking him. And I definitely say, just don't pick anybody just because they do plastic surgery. All right.
So I want to point out a couple of other things that I didn't talk about in the video. I'm going to leave a link to the American Society of Ophthalmic, Plastic, and Reconstructive Surgery. And on this website, it's going to have some resources. If you want to find a surgeon who specializes in oculofacial plastic surgery, like the doctor who did my surgery, you can actually find who are board certified members or doctors in the society who have completed advanced training in the eyelid, orbit, tear duct system, and in facial, cosmetic, and reconstructive surgery. So that is a good resource to use. And I'm going to include that. Also, I talked about, some of the pros in terms of having an incision made inside the eyelid. That is called a transconjunctival approach to a lower blepharoplasty. To make an incision on the outside of the lid is called the transcutaneous approach. And so there are some benefits to having an incision made on the outside of the lid. I did not cover that in this video, but I'm going to include a link where you can read up on the difference between the two so that you can see what would make sense for your situation. Also, I want to point out when you are looking at references for the doctor or the surgeon who you're interested in, definitely, start out on their website, look at their pictures, the before and after, but you also want to extend your search to look on, to do a Google search, right? Look at their Google reviews. Also, I would say, if they're pretty active, if the surgeon's pretty active, they'll probably have a social media presence, such as having an Instagram account or TikTok, Facebook account. There's where you'll find probably more details, more before and after pictures and video. You'll have some of their patients who have been happy or unhappy, making comments on the videos. That is definitely a good place to search so that you can actually find people to talk to directly. So instead of just reading Google reviews, for example, I went on Instagram, and that's where I found someone who I reached out to, and she sent me details, answered all the questions I had, and actually had someone approach me recently asking for the same type of information. They wanted to know about my experience, and they asked, if I could share pictures during the healing process. So I would say definitely go and look on social media and look for references, and don't feel bad, don't feel nervous about contacting people. People are usually happy if they have commented on, especially if you've seen them make comments. The worst they can say is no, they don't feel comfortable sharing. But if you want to have a realistic point of view on your surgeon, you want to speak to people directly and make sure, that their whole experience is great, because just showing the before and after pictures, that's just a small snippet of everything. That's not talking about the process, if the doctor had good bedside manner, if the patient had complications, none of those things are talked about. So definitely use social media to find people to contact. And I also want to point out, I'm going to leave a link or two where you can look at an extensive list of questions that you should ask a surgeon. I didn't go over all the questions I asked in the video just because it would have been a lot, but there's definitely a lot of questions that you should ask any surgeon who is going to work on you. And don't feel, nervous about asking a lot of questions. It's your body, you're paying them, and they should be able to answer these questions. If they cannot answer them, then you can proceed and move on to the next person. And so as you heard in my first consultation, I mean, the doctor really didn't answer much in terms of the questions I had. So I'm going to include all these links for you to visit. Um, I hope that you enjoyed this video. Please like, subscribe, share my videos, and come back and look at other content that I will be posting. I'm going to post more videos about my blepharoplasty experience. I'll also be sharing other content that is not about my eyelid surgery, but other topics. Thank you so much. Take care.